Good. Okay, so we're just going to talk for just a moment about lumbar decompression. So, lumbar decompression is one of my favorite treatments in here for back and neck stuff, especially lower back stuff. But we use it for headaches and migraines, and it does extremely well. What happens is the decompression works on these discs primarily. So what happens with people who've had acute issues, meaning it just happened, but especially I like lumbar decompression for the chronic issues, things that have been there for a while. And you may have just had your back pain might have started recently in one place, but it may be a result of something that has built up over time. And what happens, and you can think about gravity always compressing us, is that these discs in the spine, which are between your vertebrae, they get compressed over time. They also get injured and we get herniations and bulges. Now, lumbar decompression is classically created for disc herniation treatment and bulges, which is what we use a lot of it for. But I also use it a ton in your general back pain patients that don't have necessarily herniations that we're aware of, but that these discs are compressed. And the joint motion of the spine is limited or restricted so that you don't have very good range of motion, creates inflammation, creates muscle tension, creates spasm, creates nerve irritation, general pain and dysfunction. But what the lumbar decompression does, these are two vertebrae, bones in your back, and this is the disc in between, okay? When we have dysfunction in it, what happens is this disc gets compressed. In the disc, when it's compressed, it's not able to create enough space for the nerves to come out. So the nerves are actually exiting here. And then when there's a lot of space, the nerve has tons of room to play with, right? If I've got this much room and the nerve is this big, I get tons of room. If the disc compresses, what happens is this area shrinks. So now there's not as much wiggle room. And so inflammation, compression of the blood vessels. If this is a nerve, the blood vessels are actually on the outside of the nerve, the periphery of it. So they're surrounding it. My arm is a nerve, the blood vessels are lying on top of it. So they get compressed first, so we reduce oxygen to these nerves sometimes. Well, that's no fun. So that's important. But what the most important thing to understand about the disc for you is that if you're looking at it from an aerial view, a bird's eye view, so straight down the back, if you look at the disc, the outer 1/3 is the only area that has a blood supply. So the disc's blood supply is limited. So that's how we usually heal. We get blood supply to things, they heal. So you might wonder, well, and I think the question that I get a lot is, do discs heal? And the answer is yes, they heal. And the way they heal, though, is different. If we look at this disc, the way they heal is like, this disc is like a sponge. It's not like a sponge, but I'm going to make the analogy of a sponge. A disc is actually is fibrocartilage, and with some different types of cartilage involved. But it is a very thick, like pressure-resistant cartilage that helps you to shock absorb, and that's what it does. So if you have a disc with decreased height that's not doing its job, you load that back in such a way that easily creates injury for it, and it won't respond well to different types of movement or impacts to the body, and just kinetically absorbing force as it comes up through your leg and through your spine when you're walking or running or doing these different types of things, because it doesn't have that shock absorption like the shocks in your car. When your shocks go in your vehicle, everything starts to rattle, right? And then and you might have a wire that comes off or this or that, and then you start to have other problems. So it's really important to have that type of mechanism in play, not only for the nerves, but just for the shock absorption. So let's just make a note of that. So let's start keeping a little tally. So we've got shock absorption, and we've got the nerve that we want to keep healthy, and so we've got a limited blood supply. So the disc normally expands and compresses when we're moving and walking, when it's functioning well. When it does that, when it expands, it sucks in the nutrients and fluids that it needs from its environment to give it what it requires for healthy, nutrition and to keep it nice and plump. That normally a blood flow would deliver to the tissue, but in this case it doesn't have it, so it has to have the movement. So think about it like a sponge, right? When it compresses, it pushes out the waste and toxins that it doesn't need, and so it expels it. So it's kind of like a, almost, you might think about it like a sea creature, something that brings in water and expels it. But think about it like a sponge. When we expand it and then compress it, it pushes out the water. And when we open it back up, it sucks in the water. And that's how sponges work, and that's how your disc works. So it's like a sponge. Now, when it does that, when it's able to do that, it's able to heal. The problem is that once we get into these types of scenarios where the disc is affected, whether it's herniated or just compressed or bulging or all these different things, then the back doesn't move very well. So the back is limited in its function. So it's not moving enough to get the nutrients in that the discs need to heal, and so they start to degenerate. So now you get this thing called disc degenerative disease. You may have heard of that. But what happens from there is that many other areas start to be impacted. So this becomes a source of an issue. How we treat that and how we improve that is we do something called lumbar decompression therapy, which actually creates this process, I don't know, might say artificially, but artificially until it becomes natural again. So it changes it from this to this through a treatment that we do where we have you on a table that's able to open and close that disc in a very gentle, appropriate way, but in a way that is also varied and with different calculations, coordination, so that your muscles and joints don't get used to it. Because many people ask me and they say, well, can I just hang upside down on one of those little units, I can't even remember what they're called, but what is it?
Inversion tables.
Inversion tables, yeah, thank you. And those don't do the same thing. What they do is they open it up, but that's all. They don't close it, right? You have to have that pumping action. You need the pumping. It's like, give it a Midwest, what are those guys that play like I'm thinking of the movie Home Alone and John Candy, and he's like, no, it's not a cymbal.
Oh, it's an accordion.
Accordion, yeah. Like polka music. It's like, listen to me. So, like an accordion, same idea. It's another analogy that I like to use. So, in summary, well, let me say this too, chiropractic, that's what chiropractic care does really well for these back issues with disc stuff, because they help to regain that movement in the other regions affected to start to get that disc moving. But it sometimes is all it needs, but there's a lot of times where there's more therapy that's required, and that's where this lumbar decompression comes in. And when you add it with a chiropractic, and you add it with different PT therapies that we do in addition to that, it really heals that disc. It just really heals that disc. And if it doesn't, you always have surgery. But I kind of talked about two different things. I've talked about, it's all the same mechanism. I've talked about disc injuries, like herniations that people come in with, and bulges, which we see a ton of, and we do very well with because of all these different treatments. But there's also the person that comes in that doesn't know they have any disc issues, that just have back pain. When I say disc issues, what I mean is disc involvement, compression, or some kind of inability for that disc to function the way it wants to. When we combine the normal treatments that we do for somebody with back pain with that lumbar decompression, used a little bit outside of that issue that we were talking about earlier, we get tremendous results. There is typically what I'm seeing is in chronic cases, the disc is involved. And when I release that compression in there, I get excellent results with that. And I've seen it over and over and over again. So we use this in a lot of our treatments for the back. And if you have somebody available to do that, it is very helpful. I think that probably covers what I need to cover on that. Thank you.